Good evening, ladies and gentlemen, viewers from India and across the globe. My name is Zuchamo Yantan, the president of the Naga Scholars Association. I, on behalf of the Naga Scholars Association, take this wonderful opportunity to invite each and every one of you to our webinar panel discussion on the topic COVID-19 in Nagaland. Well, COVID-19 has affected over 5.5 millions across the globe and has already claimed more than 3.5 lakhs lives across the globe. And as of today, India is the seventh worst affected nation of COVID-19. Well, Nagaland reported the first COVID-19, on 24th May 2020. However, with the arrival of the Nagas who are residing across in different metropolitan cities, the number of COVID cases have already increased in the state. And until, May 24th, Nagaland was, along with Sikkim state, was the only states in India, who did not have any COVID patient. Therefore, based on this case, we can come to a concrete conclusion that Nagaland state got enough opportunity to prepare, themselves for combating COVID challenges in the state. Unfortunately, there are many cases of mismanagement of COVID-19 patients, which has already created, hue and cry in the state, especially on the social media platforms. Hence, with all these situations, emerging with the arrival of the Nagas who are residing in different metropolitan cities, it is now like testing the preparedness of the state for combating the challenges which are in front of us and which are also ahead of us. Well, keeping this in view, the Naga Scholar Association is organizing a panel discussion on the topic COVID-19 in Nagaland by inviting some of the well-known personalities in the state who will be enlightening us on the topic, and further give some directions in combating the challenges. And today's discussion is going to be a very focused discussion. We will be addressing, two main key points. One is issues and challenges in the state, and secondly, how do we reason together to address the issues and challenges and find ways and directions in combating the challenges of COVID-19 in Nagaland. Well, as I have mentioned, this evening we are extremely privileged to have some of the well-known personalities, in the panelists. Actually, all of them, none of them need any introduction, but well, maybe for the benefit of viewers from different parts of the state and also from different parts of the, across the country. I would like to give a brief introduction about our panelists. It'll be a very brief introduction. Well, first of all, we have Mr. Molomo Kikon. Mr. Molomo Kikon is a dynamic young leader who is also one of the youngest MLAs in the state, and he is also a well-recognized public leader in Nagaland. He is also an MLA, an advisor to information technology and communication, science and technology, and the spokesperson of the state government. Mr. Kigon, we are extremely privileged to have you this evening. And I, on behalf of the Naga Scholar Association, thank you so much for sparing your time to join us. Secondly, we have uh, Mrs. Mona Lisa Changija, who is the only proprietor, publisher, and editor of, a Nagaland page. She is without any doubt one of the most well-known women journalists in the Northeast and also in India. She has received several awards, example like winner of uh, Shamali Devi Jain Award for Outstanding Women Media Person in 2009 and 30th FICCI FICCI Woman Achiever of the Year 2013 and 14 for her outstanding contribution as a journalist, for the year 2013. And Mona Lisa Changija was also awarded, Nagaland Governor's Award for distinction, outstanding achievement, for her contribution in literature on January 2014. She is also a writer. She has also published a poem as well as books. Well, we are very privileged to have you in our midst this evening. On behalf of Naga Scholar Association, I would like to say thank you so much to you. Well, we have Dr. Serivi Angami, who is one of the most decorated leading medical doctor in the state. He is not only recognized as a medical doctor, but also a humanitarian. He has done his super specialty in DMA, gastroenterology, from CMC Valor. He was also a faculty at CMC Valor, as well as a senior registrar at CMC Valor. Presently, he is the director of CIHSR, that is a referral hospital. Well, Dr. Angami, we are very thankful to you for accepting our invitation to be here in our midst. Well, again, we have a very well-known personality, Mr. Abhishek Singh. In fact, he is a very prominent face across India. Mr. Abhishek Singh is an officer of the 1995 batch of IS with diverse experience of administration, managing law and order, implementing development programs, and of policy formulation at central government with regard to use of technology for improving governance. He is presently posted as CEO mygov.in with additional charge of president and CEO of NEGD. When he has done his master's in public administration from Harvard University, and also he did his BTech and also MTech from IIT Kanpur. Thank you very much, Mr. Abhishek Singh, for taking out your time to be with us in today's panel discussion. Well, lastly but not the least, of course, we have Father Abraham Lotha, who is joining us from New Jersey, rather. Yeah. Father Abraham Lotha, again, is a very well-known, recognized thinker, in the Naga society. He is a Catholic priest and a very well-known, recognized academician, the author of some of the leading books on Naga society. He is also alumni of Columbia University, which is also one of the leading universities in the world. He has been a visiting faculty in several universities and also has delivered several lectures in some of the leading universities in the world. Yeah, Father Abraham Lotha, we are very thankful to you for taking out your time and joining us this evening. And well, today's reporter is Mr. Gege Lung Nathan, who is one of the executive secretaries of Naga Scholars Association. And we are very thankful to Mr. Pralat and his team for giving us such an effective technical support all the way from Mumbai. Well, once again, I take this opportunity to thank all all the panelists, for accepting our invitation to be one of the panelists in today's panel discussion. And I also welcome each and every one of you viewers and listeners from across India and across the globe on the panel discussion on COVID-19 in Nagaland. Well, with this, now we will go straight to the topic. As I have mentioned, the first part of the discussion will be focused on issues and challenges in the state, and I would like to request all the panelists uh, to kindly take about 5 minutes or maximum 6 minutes, so that like all the other panelists will be able to get more time, and also participants will also be able to ask some questions. So with this, I would like to request Mona Lisa Changija to share her perspectives on the issues and challenges in the state. Yeah, I give the time to Mrs. Changija.
Okay.
Hello. Yes.
Yeah. Okay. Can you hear me once?
Yes, we can
Uh,
hear you.
Juchamut, I want to say hi to you and all the panelists. Good evening. I hope all of you are well. Now, I also would like to say that, you know, thank you, but no thanks. I won't speak first for one reason. You and I had a talk the other day, right? And you gave me some of the reasons why you had asked me to participate, one being the media thing and the other being that gender thing. Now, because of that gender thing, and this is, I know, a private conversation, but since it's neither seditious nor scandalous, I think I can talk about it here. uh, my opinion as a woman, is that unless and until Naga society and state says ladies first into the assembly and all constitutional elected bodies, I think I should be a good Naga woman and be the last to speak. And therefore, I hope you will forgive me this, but I will definitely speak. Is that okay, Chushamo?
Okay.
I know it is a surprise. You didn't expect this,
Uh,
but we have to use all platform, especially when I am also supposed to be uh, representing the women of Nagaland. So this is just a stand that and I hope that you will respect this. Thank you so much. I will speak,
okay. Okay.
Peter.
Thank you so much anyway for for expressing your views. We respect your views. Okay, then what we will do is I would like to request Mr. Sedevi Ankami, Dr. Sedevi Ankami, to kindly share your perspective on the issues and challenges in the state.
Okay, good evening, and thank you for inviting me into this panel. I will be talking from a more of a technical point of view. And of course, there are other areas which will be covered, I'm sure, by the other panelists very well. First, to start with, if you look at the current statistics as of today, and from the Johns Hopkins Coronavirus Resource Center, the cases in the world are more than nearing 7 million, and the deaths almost about 4 lakhs. In India, this is from the Ministry of Health and Family Welfare. The cases about nearing a little over 1 lakh, which have been cases, active cases, near about the same which are cured or discharged, and the deaths are about 6,500. The death rate is about 3.35%, but this varies greatly from state to state. So it could range from 0.6 to 9.57%, which is a very wide range. And if you look at just the death rate, you will find that it will vary from state to state, from age-wise, depending upon which kind of people you are testing. If you are testing only the young people, the death rate is likely to be very low. If you are testing predominantly the old people, the death rate is likely to be high. So you need to stratify these findings. It could again be different from rural to urban, the type of population, or even at the point of time you are measuring it. So it could be 3% now and it could be 10% tomorrow. So it's very difficult to really, it's just a death rate in a point of time. Now, as far as Nagaland is concerned, this is what I picked up from the Department of Health and Family Welfare, that they have got about 107 cases. And from the newspapers and interacting with people, almost all of these are asymptomatic or very mildly symptomatic, which means, and we all know that most of them are all from the returnees. So far, we have not documented community spread, which we cannot say it doesn't exist, but it's difficult to categorically say that there is community spread. So as of now, we'll have to assume that these are predominantly from the returnees and from the quarantine centers. So these are all within the age group of 18 to 44 years. So I don't think we need to be very fearful at this point of time. The world over, statistics and studies show that most of these people will do well, unless they're very unlucky. Exceptions can occur and that nobody can guarantee, but most of them are likely to do well. So I don't think we need to immediately panic, but definitely community spread can occur, and that's something nobody can stop. Now, as far as the facilities which are available in Nagaland, I know that there are COVID hospitals in all the districts. Many of the district hospitals have been changed into COVID hospitals, so they don't see any other patient except COVID. You have the quarantine centers, which are government funded, and a large number of them are in Dimapur. Many of them are church supplemented, means the churches and NGOs are giving their bit to help. Some of them are like in hotels and all, where people want better facilities, and these are self-funded. Home quarantine will be coming in, and a few people might be in that. And the other area which now I feel the government is looking at is the COVID care centers. And these are being planned for asymptomatic or mild cases. So a large number of the patients who are in the hospitals would possibly be shifted to COVID care centers, because they are actually quite young, asymptomatic, and they may do well. So when people say, are we really prepared? Well, let me tell you that nobody in the world can ever be fully prepared. I don't think this is a good question to ask. We can say, are we improving our preparation? Yes, definitely. And we have to keep working together. So, but when people say, we are not prepared, I think it's a bit exhausting to listen to that. So I think there's a lot of preparation which is going on, and people are working on the ground quite hard, and so we need to cooperate with that. As far as testing facilities are concerned, there are various testing facilities which are available in the state. One is the BSL-3 lab, which has just been commissioned in Kohima, and this is the RT-PCR. It has a total capacity of about 96 wells, but because of controls and all, they could do about 90 per day, and I think they are scaling it up in Kohima. This is very high tech. You need very intensive support. You need to have trained manpower in molecular techniques, very sophisticated, and there's also a very high cost of maintenance. So this is best suited in institutions. And in Dimapur also one is coming up.
Mm.
The second is the TrueNat. The TrueNat is on a TrueLab platform. It's much lower cost. It can do about 32 to 48 tests in an hour. It requires just medium level support. Medium level training can be set up very quickly anywhere. It has two steps. One, you check the negative. If it tests, the first step, if it's negative, it's negative. If it is positive, then you can validate it again with PCR. Now, this is a very good test, and I think the government is trying to introduce as many of these in various parts of the district. I think that's a very good and important move. And I think it's worth spending a lot of money on getting as many true test, because once the COVID situation is over, we can always use the machines for HIV, hepatitis B, etc. These are the two tests available, but in the country, of course, rapid antibody tests are coming all over the world, and this would predominantly be used for mass surveillance. And you can get a report within 30 minutes. And this is for people who are more than 7 days. I think this has got a very important potential use for mass surveillance when you're looking at thousands of people. There are other things like ELISA, Cobas, Roche, and things like that, which are, of course, again, very operator dependent. Now, as far as PPEs, social distancing, hand washing, sanitizers, etc. are concerned, I think this is fairly widespread knowledge, and therefore I won't be talking on that. Now, when people are, if we have a severe case of COVID, then what are the things that we have at hand? So worldwide, and this is from uptodate.com, the latest recommendations from UpToDate is that these are, in India, there are drugs which have been tried, remdesivir, tocilizumab, convalescent plasma, certain antivirals which are used in HIV, interferon beta, and other biologicals. Now, these are all being used on an experimental basis, and we need further trials, but in the absence of anything better, we'll have to use whatever we have. The Joint Monitoring Group in the Ministry of Health has recommended hydroxychloroquine to be used for prophylaxis, but we know that there are some fears of cardiac problems, and therefore it needs to be used by informed consent. As far as vaccine is concerned, we know from experts that it might take about 16 to 18 months to develop. Some people feel that they could produce one by even September, October this year. We're not sure, but we're hopeful. If that comes, that will be great. So that's my just roundup of the current health status in the state. Yeah.
Okay. So thank you very much, Dr. Sedevi Ngami, for sharing your perspective on the issues which we are facing, of course, with sharing with some global perspective as well. Well, now I would like to request Mr. Abhishek Singh, IS officer, to kindly share his perspective. After which, I would like to request Madam Mona Lisa Changicha to come in.
Thank you, Chamo, and what a pleasure to see Dr. Mona Lisa, Dr. Sedevi, and Molumo on an online platform. And I really thank Dr. Sedevi for his insightful details with regard to the COVID, how it works, how it spreads. So first and foremost, like I have been involved in this whole process since the pandemic started in India, because I'm as part of MyGov, I was handling the communications for Ministry of Health, and we realized that communication plays a key role in control of this pandemic. The biggest challenge that we faced to begin with was that very little was known in the beginning about this virus and this pandemic, and still I would say we do not fully know about this virus and this pandemic, about how it works, how it functions. Epidemiologists are struggling, and when I speak to epidemiologists and top doctors from AIMS and everywhere, they all say that research is going on, they are trying to figure out how it spreads. But the problem with the most of us today in the connected world, especially when information is easily available and easily shareable, is that more something is unknown, more the experts we find. So we find all kinds of theories floating around. So when we started the COVID-19 campaign across India, we found that it was full of myths. It was full of myths all over, like what to do, what not to do, and there were everyone who had one opinion or the other on it, other than the top epidemiologists who came up with basic instructions with regard to what is the it that can help us contain it. And when you talk to them, the prescription that the top doctors and everyone says is the 3T approach: test, track, and treat. So the most important part of containing this pandemic is that you have to test, because one peculiar feature of which has been observed across the world, whether it's China, whether it's Lombardy in Italy, whether it's Spain, whether the US, everywhere, is that when you have the virus, after that also you remain asymptomatic for a very long period of time. You don't have any symptoms for 10 to 14 days. And during this period, you keep on thinking that all is well with me, even though you have the virus, and you keep on moving around and you infect people, and they become further spreaders. And so it spreads exponentially. So this is a peculiar feature of this virus. And after that, also, the only way to stop the spread is to break the chain. How do you break the chain? You break the chain by staying home. You break the chain by bringing in lockdown. So that has been a standard measure across the world. And then the other basic hygiene features, behavioral change, hand washing, social distancing, quarantine. In fact, when we started in February, 90% people whom we interacted with did not know what the word quarantine means. Today, the quarantine is one of the most used words, and everybody knows what is quarantine. But if you ask anyone in US or in India, most common people would not know the word quarantine, but it's become part of the lexicon. So very important part is that to understand that behavioral change is the key part of it. And now the question with regard to when we look at Nagaland especially, and we are like today, like now when the virus has reached Kohima and Dimapur and the other districts, we are thinking that why it has reached, how it has reached. So we have to first and foremost assume that nobody will be immune from this virus. The virus started in Wuhan in China. As people traveled, as people moved around, it spread from Wuhan to Europe. Lombardy is a city in Italy where 90% people are from Chinese origin. They own almost all the factories in Lombardy. So from China, it came to Lombardy. From there, it went to Spain. It went to US, everywhere. And from there, it came to China, India also. And within time, it was only a matter of time when people move, people travel, that the virus would move to other states also. So while Sikkim and Nagaland were quite comfortable for a very long time, but as and when the lockdown restrictions have been lifted, and as people are coming back homes, we have to expect that the virus will come. But when the virus is coming, only thing that I would say is that it's not to, one doesn't require to panic. What one requires to do is to prepare, but not panic. And how do you do that? To do that, you have to have the right information first. Have the right information, ensure that everybody who needs help is given help. Another peculiar thing I would mention, ki amongst all the cases that have been observed world over, what has been found is that 80% of the positive people are also asymptomatic. Number of people who require critical care is very limited. In India, we have found that people who require ICU care, people who require oxygen beds, people who require ventilators is of the order of around 6% only of the total number of infected people. So, and though who are these people? These people are primarily people who are 60 plus and people who have got comorbidities. So, ICMR has also revised their guidelines, and now they say that even if you are detected positive, you can stay at home if you are not having symptoms, or if you are having mild symptoms. So the point that I'm making is that even though many of us might not have been tested and might not have been found positive, many of us would be carrying the virus. The good thing about the virus is that it will not kill us. It will come and go, and we will have to live with the virus for till such time there is a vaccine or there is a cure. So far, remdesivir and this HCQ and SE, these medicines have been prescribed, but nobody has come to a conclusion that it helps. Only thing that has been found to be helping is oxygen therapy. So those who are vulnerable need to monitor their oxygen. And the other thing that has been recommended is, which is proving to be useful, is immunity. How do you boost your immunity? How do you ensure that you remain fit and practice better hygiene facilities? Having said that, the health infrastructure, the lockdown that we had in India for almost 2 months, is one of the strictest lockdown. The period that it gave was enough for us to help prepare for for facing the pandemic. So now we have 500 factories which are producing PPEs from zero, which we had in January, and we have sufficient supply of PPEs. We are even in the position to export that. So we have sufficient infrastructure, we have sufficient medical supplies which can take care of the requirements within India and at all the states of India, including Nagaland. All that is required is that we have a coordinated strategy with everyone. Don't create panic news. There is enough that can be done to help our people, and there will be some deaths, but these deaths would have otherwise also. It's very sad to say that deaths will happen, but it's not that deaths are unknown. So deaths have been happening in the United States. We also have had, and we are saying that some states have, some cities in India have reached their peak. For example, if you look at Indore, if you look at Gandhinagar, the data modeling that we are doing, because with the entire data that is coming, we are also doing data modeling, using data science, using simulations. So all that is indicating that with the best of the efforts also, there are cities like Ahmedabad and Indore, they have peaked now, and the cases have come down. Even Jaipur, it is coming down. But then Mumbai is peaking, and we predict that cases in Mumbai are going to rise in the next few days, and Mumbai should be peaking around 12th or 15th of this month. Delhi will peak by the end of this month. The Delhi cases will continue to rise, and all other cities, whether it's Pune, whether it's Bangalore, whether it's Patna, whether it's Lucknow or Guwahati, all these cities will also may also see a surge in cases. So we have to be prepared about it, that the virus is within us. We have to live with it, and we have to take necessary steps in order to ensure that we don't panic. The other thing that I was associated, my department was associated, we built the Arogya Setu app. What the Arogya Setu app does is that it helps in contact tracing. The app works on the model that any problem. I hope I'm audible. Yeah, so the Arogya Setu app, what it does is that since the virus spreads when you come in close contact with somebody who is COVID positive, it tracks your location and it tracks who you are coming in a Bluetooth range. So it will keep that data on your phone. And once anybody you have met in the last 14 days is tested positive, that information will go to the server, and then you will be alerted with a yellow status on your phone, which will indicate a moderate risk or a high risk as an orange status, and then you will be required to either go for testing or you will be required to self quarantine yourselves. So these are the measures with which we can control the virus. So again, I would to reiterate, in the interest of time, I would just say that we need to prepare, but we need not panic. We need to have trust in our frontline health workers, because they are the ones who are actually exposing themselves to risk, and we need to ensure that we do not create an atmosphere of mistrust, because the moment we do that, the frontline health workers, their family members, the cops who are on the street enforcing the guidelines, they get scared. And if they get scared, then who will stand by us in the time of need? So we have to ensure that we have to take individual precautions. We have to, testing has to be increased. We should test as much as we can. We have to do tracking with the help of Arogya Setu app or physical tracking. We have to ensure that the people who have been tested positive or people who have come in close contact, they are quarantined, and quarantine means strictly quarantined or home isolated. They do not interact with anyone, because if they, then only we can break the chain of virus. And all those people who are going to continue with their livelihoods, because lives are important, livelihoods are also important. For those people, we have to practice basic hygiene, which includes hand washing for 20 seconds, then use of masks, and then practicing social distancing. So these are the measures which will become the new normal in the days to come. So crowding has to be changed. We have to maintain distancing. We should not shake hands, because that would lead to transmission of virus. We have the culture of namaste in India, which has been copied by world countries across the world. So I think with these and practicing improving our immunity by a lot of Ayurveda and Ayush ministry has come up with several solutions. If we start practicing that, we will be in a better position to face the challenge which is there. We have to only realize that the challenge is not going to go away overnight. Nobody is immune. We should not expect that like in any part of the country it will not come. I'm very happy to see the great response of the community. In fact, somebody shared me some churches have come forward in trying to help people in this time of need. Mon district, I saw certain initiatives where they have 111 app and they are calling 1 plus 1 11. So community is coming forward. I saw some videos from Mokokchung. So when community, when citizens, when government, they all come hand in hand, then that will be the strength, that will be the resilience we have as a society in India. Or Nagaland is much better known for its community strength. So together when we are, and we trust each other, and we try to build up a coordinated strategy, we will be able to face this pandemic much better, and we will come out of it. So this is what I wanted to say. If there are any questions, I'll be willing to take. Yeah.
Okay, thank you very much, Mr. Abhishek Singh, for sharing your rich perspective on the issue. There will be questions, but we will come back to you later on. But for now, let us go to Mrs. Mona Lisa Chankicha. I think it is very important to hear her perspectives on the issues and challenges. So now, may I request her to kindly take her time?
Right. Thank you, Chichamu. I am going to come right to the heart of the matter,
Mhm.
and this is Nagaland specific.
Yes.
Okay. So I have just written a few points about 4 5 points. So I will just be, I will just be reading them because if I speak, I tend to get digressed. So uh, number one, it's been over 2 months since the pandemic lockdown, and our state government still doesn't seem to find its feet about how to deal with the multidimensional issues that have arisen and will continue to arise from here on. So, for example, A, issues related to the safety of our health workers, health and other frontliners, as well as the urgent infrastructure and equipment, etc., required to treat positive cases, especially serious ones. Um, Thankfully, we don't have any such till now, but anyway, to treat serious cases as yet. So they are yet to be holistically addressed. Now, now that the public are constructing ICUs, besides donating cash and kind to our government hospitals, see, these speak volumes of our state government. This speaks volumes that our state government is still lost in the woods. B, replacing or integrating the COVID war room with the high power committee is actually neither here nor there. It's the same people still making or not making decisions. In any case, the war room was also under the direct supervision of the chief minister, other ministers, and political advisors. Now, the point here is that whatever the name of this COVID authority, whoever sits in it, we see a marked lack or absence of decisiveness. SOPs keep on changing, are not adhered to, and then finally responsibility is shoved off to districts and public oblique civil bodies. The management of returnees since May 22nd is another case in point. Now, the second point, the COVID says this calls for an in-depth study. See, the central funds we receive to fight this pandemic is not a small amount if utilized judiciously. Now, that is the crux of the matter. And so our government felt the need to levy tax on tax, hence the cess. So why are the public, civil, that's including the churches, public civil bodies, including the churches and individuals paying for construction of government health facilities, buying urgent requirements for health and other frontliners, and feeding inmates of quarantine centers? See, community participation, uh, is it okay?
Yes.
Yeah, okay. Community participation and contribution is laudable and is a strong point of our society. Okay, strong community bonds, our main social capital, are in our DNA. Okay, they also provide the safety, the social safety net. But that doesn't answer the question, what is happening to the central funds now? Now, the third point, right now, our focus is on the health aspect of the pandemic, management of returnees in terms of transport, accommodation, food, etc. But it is high time to direct equal attention towards education and economics also. Other states have already started the process of rebuilding. I, you know, I will repeat again, rebuilding their economies. We haven't even started the process of building ours, in fact, right from statehood. Both these issues merit in depth studies. Both merit highly specialized think tanks. I'm using the word think tanks very broadly and loosely, even from outside the state. The time has come for us to let us go of our egos and concede we need help. The fourth point, see, there's much more to say. But for now, let me say that our main problems is the absence of a decisive, informed, effective, and efficient political leadership. This obviously connotes the absence of ideas and ideating within that leadership. Now, one, what compounds matter is when we don't know that we don't know. Two, when we try to deal with a pandemic the way we run an election campaign. Still, still, I believe that the pandemic has created the space and the scope for us, for Nagaland, to begin all over again and possibly write a new social contract. Now, the fifth point is, I'll just use few words for that, is the social and civil rights and liberties in these days of the pandemic. Now, why this has become, for me, it has become a crucial issue is because you are aware that some people have filed RTIs and PILs as regards to anomalies in the purchase of goods, medical supplies, etc. It is well documented in the public rep. Now, here I find we have a group, an association of doctors who feel that, in the first place, we received an email saying that, people, groups, associations, individuals should not file RTIs and PILs at this time. Recently, again, we got, their opinion is that such PILs and RTIs at this moment is hampering their health work, the medical aspect of the work. But I thought that, number one, as I have repeatedly written, the Constitution has not been suspended, number one. Number two, which means, therefore, our civil and social rights are not suspended. Now, the thing is, I think it is at times like this, at times of pandemics, and at such, let us say, abnormal times, so to speak, that we have to strengthen our civil and social and our constitutional rights, liberties, and freedoms. So that is what I feel about strongly. So I think that for both the groups, I have more or less said everything. So maybe we can cut down on that, but we will continue the thing. Thank you so much. Thank you so much.
Well, thank you very much for sharing all the challenges that the state government or the Nagaland state is facing at the moment, and also giving some kind of a direction Of course, we will come in later on, and of course, there are many questions that many questions are also coming on the way. So before that, we will now go to Father Abraham Lotha. We will request him to kindly share his perspective on the issues and challenges.
Good evening, everybody. It's very hard to talk about Nagaland from way far away from here, and so it'll be wrong on my part to pass any to come up with any solutions. But what I can say is, as right now as we speak, I'm actually waiting for a phone call to do a funeral sometime next week for a friend who died of COVID the day before yesterday. And this will not be the only funeral I will have to do. I've had already a couple of funerals here in my church. And so I think what we are discussing today, more than just the 3 T's that Mr. Abhishek mentioned, test, track, and treat, the social education, social communications, social consciousness about the pandemic, I think is very valuable. And it is a responsibility not only of the state, not only of the government, but of everybody, every Naga and every citizen. This is a crisis that the governments all over the world did not have internship before. So this is the first time that we are experiencing such pandemic. And so what I observe is that in Nagaland, there's a lot of blame game going on. I think instead of blaming each other, instead of blaming the government, if we can put our heads together, help the government to tackle it, to approach it, I think it'll be good. I don't need to go over statistics. As one of the viewers mentioned, we know the statistics worldwide in the US and where I am. But anyway, so we learned quite much in these days that human civilization has not eradicated infectious diseases forever. This is not the first time that we're dealing with diseases like this. We've had AIDS, Ebola, Lassa fever, SARS, MERS, and now this COVID-19. Certainly, there are a lot of causes how this happened. A lot of theories are still going on. But I think what we need to keep in mind is until we have a vaccine or treatment, containment is our only hope. And Nagaland government is at the moment not worried about or not spending money for finding treatment or vaccines, but is allocating resources for containment. And so I think we need to help the government in the government's effort and also in the society's effort. We see a lot of good examples coming out from various sections of the society, be it churches or civil society, trying to help those returnees in the quarantine places or in various ways that they are trying to help. And so as we go about how to deal with this pandemic in Nagaland, I think it's important for us to have more, to allocate a lot of time also for social consciousness and social education, keeping in mind everybody has been saying, in terms of hygiene, but also the social problems. It's not only the coronavirus, but lockdown virus or quarantine virus. How do we deal with this kind of misinformation? As one of the speakers said, there's a lot of misinformation going on, a lot of rumors, but we have to know that, for example, people who may be asymptomatic may not know that they have, and they may spread the disease to others. For example, by March of this year, it was known that a large number of people were unaware that they were infected. And so they contributed to spread the disease. And a lot of the people got the disease from people who were asymptomatic and did not know about it. Fortunately, from experiences worldwide, we are, I think, in a better situation now. And we don't need to reinvent wheels. We can learn from people's mistakes. We can also learn from other people's best practices. I think it's important there are different prongs that we need to be attentive to. Those in our society who are vulnerable, especially adults 65 and plus and older who are at risk, or those with pre-existing conditions, I think it's good for us to inform the society that we need to look out for that section of society, not just trying to isolate them, not just trying to tell them to be careful, but also a lot of people have experienced loneliness at this time. So how do you deal with loneliness, especially those older people who may be experiencing loneliness? Fortunately, the Naga society, older people, everybody stays together. And so sometimes we may be afraid not to infect the older people, but in the process, they may also develop depression and loneliness. So I think we need to watch out for those kind of experiences. Also, people express anxiety and fear in different ways. And at this time, the parents, not all parents are same, not all of them engage with this pandemic in the same way. Some of them maybe are paranoid, and how they express their fear in dealing with this disease also can trickle down, affect their kids. And so the kids will learn a lot from their parents, how they approach this sickness. I think it's important that parents are aware of this. Parents need to talk straight to their kids, educate them, and yet not pass on their paralyzing fear. I think that's important. Also, the government, the way the government deals with this and talks about this crisis will also influence. Granted that this is the first time that we are going through this massive crisis experience. So even the government is learning as they deal with this every day. But a trustworthy information is very essential. If people know that people can trust the government, I think that's very important by way of giving confidence to people, and then people can help also the government. People can also point out if there is some mistake in the government's approach, because if that is a mistake, and the government can be trusted if they say, oh yeah, that's a mistake, let's find out other approach, help us find other ways of dealing with it. Also, it's important that, the government gain the trust of the populations. And here, I think it's important for the government to be transparent. There are a lot of accusations in the Nagaland media, print media or social media about government not being transparent. I don't know whether those are true or not, but I think it's important for the government to be transparent and to communicate frequently. I realized that I've been trying to also help some of the teachers record video messages or lessons for their students. But some of the challenges we find that everybody does not have a smartphone. Everybody does not have access to WhatsApp and other social media. And so the radio is a very effective method. And people in the villages, including my mom and dad, listen to the radio and they pick up from the radio. And so that's why the government can make use of such kind of resources, communication media, to inform our people whatever information they need to give to the people. And places like Nagaland, it's very difficult to have the lockdown strategies like other people in the world have. For example, in most homes, they have only one bathroom. So if their whole family shares the bathroom, it becomes impossible for somebody to be quarantined or locked down at home. And so the various quarantine places now that we have, I think they're good, only they need a lot more support, that people are not paranoid, that people are not stigmatized, and that they are helped in different ways. So the ways that the government, our people will approach this pandemic, I think it's very important to put our heads together and not play a blame game. But since this is a crisis that we all are experiencing for the first time in such a scale, I think it's important for us to listen to each other and also learn from other people's mistakes and other people's success stories. Thank you.
Okay. Oh, thank you very much, Father Abraham Lotha, for sharing such a rich perspective on the issue. Well, we will go now to Mr. Kikon, Mr. Molam Kikon. So we would like to request him to share his perspective or the government perspective on the issues and challenges which the state government, the state is going through at the moment.
Thank you, Dr. Jabu. It's a pleasure to be in this webinar. I'm sure that we are a little late in having this discussion. I think from what I have heard from the esteemed panelists here, we should have had this discussion long time back. But it's never too late till a vaccine is discovered or found. We would still be fighting this COVID-19 challenge. I would like to start by sharing one piece of news. Today, the Principal Director, Health and Family Welfare of Nagaland has informed us in a discussion that out of 10 positive COVID-19 cases who have been retested, we call them the Chennai returnees, 8 have tested negative. So in a way, because the common age group is between 18 to 44 of those who are under quarantine, this is a good piece of news. And it's a positive news in the light of all the challenges we've had, especially through the panic-stricken, sometimes fake news, which have been, peddled around in social media. I would like to begin by acknowledging some of the very prescient and I think intelligent observations made by our panelists. Let me begin by also saying and acknowledging the fact that when this pandemic was first, announced, or when we heard of it in the month of maybe December, the world, as we know, was not prepared. No one was prepared for this pandemic, and I agree with Dr. Sedevi and Abhishek that the panic that this caused is in Nagaland equal to the fear of the unknown. The issues that have been raised by the panic has also had to be dealt with by all of us, both the government and the civil society and the churches. When before the lockdown began, the government had 3 multi-pronged actually strategies, but 3 key priorities. Number one, we started by, let me tell all of you, including the viewers, that we started by acknowledging that our healthcare system and the infrastructure in Nagaland is not as good as the ones in New York or Italy. We are in, even in India, we are far behind other states. So keeping a very realistic assessment of where we are, the decisions and strategies started. Number one, we know that at one point of time after the lockdown is relaxed, our citizens who are working in studying and working in other parts of the country will come back. So that was something we had in mind. But initially, the main challenge was to ensure that we ramp up our health infrastructure in all the districts. So because of that, we had declared all the district hospitals as COVID hospital. Number two, our quarantine centers have to be ready for the inbound citizens of Nagaland who will be coming from other states. So we coordinated, and the ministry, the center has been very helpful right from day one. We've been coordinating with various ministries to ensure, for instance, the railway ministry for transportation, health ministry for all the guidelines that they issue, and the MHA also, the general SOPs that we have come up with has been based on the national SOPs that we have received. Now, the initial challenges was because every student who were studying outside, or even working persons from Nagaland who are working outside, and those who wanted to come back but because of lockdown could not come back, we had developed a strategy of helping them, and more than any other state in the Northeast. First, we announced a special package, Chief Minister's special package of around 3,000 for students and 4,000 for working person. And after after taking stock of all the suggestions that were coming in from various, both organic and institutional intellectuals, and also from our own pool of bureaucrats who were on the ground and who had all the data available with them. Through the war room, it was decided that for those who wish to stay back at their present locations in other cities of India, a special assistance of 10,000 would be given. We have not announced the amount that we have dispersed till date. So it's also, privilege for me to announce on this Naga Scholars Association webinar that till date, around 24 crores, 84 lakhs have been dispersed to students and working persons. And we would be very shortly, in 3-4 days time, publishing the names of all those people that we have given financial assistance. The other special package, which I forgot to mention, was for patients who were on treatment outside of the state, whose welfare we have taken care of by providing rupees 20,000 per patient. Now, in the entire Northeast, even though we are a small state, even though we are a resource-strapped state right now, and we are dependent on most of the central grants mostly, and we've been able to provide assistance to those. But because of the lockdown again, we had to look at two aspects of our citizens. One, the migrant laborers who were stuck because of the lockdown. The other, all the citizens in the rural sector. So for those, till date, for 3 continuous months, Nagaland government had been supplying essential food items to migrant workers and to in the rural sector to all those people who have the ration cards. And for those who didn't have ration card, the district administration identified and supported them with essential food items for more than 4 lakh people we have distributed till now. So one of the strategies, for instance, lockdown brought certain challenges, and SOPs, although the main, I would say the structure of the SOP remains based on our learning experience, because our government is also sensitive to various issues and challenges we come up which require specific solutions. So we have been able to change the SOPs according to that. For instance, a lot of discussion is on the returnees. Number one, when on May 24th, the second month of after the second month of the lockdown, the returnees started coming. We were faced with the challenge of quarantine centers, but because of the panic and also the contribution to the panic by various agencies, especially in social media, it was not helping. So we came up with an SOP of ensuring that there is 14-day institutional quarantine for all the returnees, and then another 14-day home quarantine. But now medical experts, Dr. Setivi is here, more qualified to talk on the dangers and also the way this is treated. But of course, to make matters very clear, I know for a fact there is no treatment. So we've also been using All India Radio, or we've also been using various groups like Dreams Unlimited to ensure that public communication awareness is done. Of course, our strength, as everybody has reiterated, is our community. And we have been engaging with all the civil society. We have been engaging with them in ensuring that the scale at which the government is helping our people is supported by our communities through their participation. We are a very giving society, and I think I've realized more than anything else that in a pandemic like this, we may have people who are pessimistic, we may have people who have issues because certain isolated issues have been generalized. And these have been used in the media to ensure that government gets a bad name. I think in spite of our shortcomings, in spite of our challenges, we've been able to ensure that till now we have around 13,000 plus beds and 238 quarantine facilities to take in all the returnees. Now, initially we were thinking that because of the applications that we received for the financial assistance, we were thinking that around 40,000-50,000 will come back. But when we realized later on that only around certain amount of people have taken, we were thinking that at least 27,000 people will come back. But today we are in our data we have at least we are expecting already 8,000 something has come back. We are expecting 6,000 or 7,000 more. So total it will be 14,000-15,000 who will be coming back from various cities. We are also aware that institutional quarantine and will end after some time. We will be especially only for those positive cases who will be in the COVID hospital. The rest who have completed and have tested negative will be sent back to home quarantine or the respective district. We have already started sending to the district quarantine centers. Now, I just like to highlight to you the mindset. The reception was that if you are tested positive, people thought it was the death sentence for them. So that was the challenge. Managing fear is one of the greatest challenge that we face today. So we have also decided, we have had several meetings with All India Radio and various agencies so that we ensure that people understand the whole idea of the whole aspect of this COVID-19. So in a way, this we have learned over the few months that we have tackled COVID challenge. I would not say that we were not prepared like anyone in the world. As Father Abraham has really succinctly pointed out, there was no internship for this COVID-19 anywhere in the world. So I think given our shortcomings, as many will point out, we want to say that the frontline workers, our doctors, our administrative officers, our nurses, our policemen have been working tirelessly day in and day out without sleeping, without proper rest. And it is because of this that we have come to this stage. Today, I will proudly say, initially, we didn't have testing facilities. We had only, after a period of more than a month, we could set up the BSL 3 lab in Kohima. Yesterday, I visited the BSL 2 lab or 3 lab being set up in referral hospital. I met Dr. Sedivi as well. And then we have the TrueNet machine, which is in Mon and Mokokcho. Now, in 5 days' time, today we have already installed 7 TrueNet machines. The TrueNet machines were installed only late in the day because ICMR had not given us the go-ahead. The confirmation that this machine can be used to confirm whether person is negative or positive. So this was given approval by the ministry, by the ICMR, only a little late in the day. So now in 1 week's time, we are very proud to say that we will be able to test 820 people per day. We were relying on Assam, especially Jorhat and Dibrugarh and Imphal. But now with all this setup and more to be set up in the next 5 days, due to the rain, we could not transport the machine to Kifri and Trinsang today. But in the days to come, I'm sure we will be able to reach them. So in terms of preparation, people are, it's also the government's maybe shortcoming that we were not able to communicate properly all the preparations that we have been doing because we are beset with all the challenges that we face daily. Now, in the quarantine centers, we have had lots of issues, and I would like to request all of you to highlight and support and also give your suggestions. We have a war room which is open for suggestions to any citizen. We don't necessarily check all the social media posts because sometimes it can be due to the lockdown. A lot of entertainment has come in through the social media, but some of the serious issues that have been raised and some of the serious challenges that we have faced during the period, we have been having meeting. The high powered committee has definitely had a meeting every day to discuss all the issues of every district. Right from the beginning, video conferencing headed by our chief minister with all the DCs, SPs, and the chief medical officers of all the districts have been conducted. and regularly, on a regular basis, our manpower is being used to ensure that quarantine service centers are functioning. You see, from the beginning, from arranging the train to bringing them to the testing centers, to bringing them to the quarantine centers, and also to feeding them, it has been the responsibility of the state. We have spent so much money on doing all this, and we will continue to spend on the citizens of Nagaland, and we will be publishing our expenditure report from time to time, because we want to ensure, we have no time right now to counter all the challenges of how many money we have spent, how we are spending it, but it is transparent being done. And as far as our institutions are concerned, all democratic institutions are functioning, and democratic processes are being encouraged and supported by the government, because I think even filing of RTIs, even filing of cases in the court, there has been no attempt by the government to tell anyone not to file RTIs. I mean, it is I would say, if an individual or some organization have said, it is in their own capacity that they have said. I think as far as we are concerned, we are happy that people, our citizens, are engaging with us critically. You should challenge us because you have elected us. And if we have failed, I think any criticism is more than welcome. The important thing is that we have to understand that COVID-19 does not recognize any status, any prestige, any position. It is going to affect all of us. So I think the spirit of positivity has also to be promoted by all of us, because it is required in this time, especially in Nagaland, in the entire country. In the entire country, I have not seen so much panic as I see in Nagaland today. So in order to, as I was saying from the beginning, Dr. Jamu, we should have started this discussion from the beginning. If we had done that, I think some of the serious issues, very proper and important concerns raised by our panelists, especially Mona Lisa, I think should have been discussed openly together, and then we would have some of the things that she has raised. We have already been doing, but there has been some communication gap, I think, between us. But I would like to also tell you that in all the statistics that I have provided, in all the strategies that we have adopted and we are continuing to adopt, I think it has been based on realistic assessment, based on the advice on our administrative officers and doctors on the ground, and any issues that have come up. I think the government has been very serious in its intent to ensure that we don't repeat any mistakes we have committed, and we learn from it. And I think it is time all of us come together. Our main challenge, before I conclude, I would like to say, is that we should prevent community spread, and therefore, in order to ensure that community spread is prevented, we are trying our best. Contact tracing is heavy. I think for Nagaland, it's a very, I would say that we have an efficient system of contact tracing. Testing will improve. And as as Abhishek has rightly pointed out, testing is something we are going to focus on. We have the capacity now. 2 months, or let us say nearly 3 months, 3 months running now, has given us the opportunity to prepare ourselves. So let me say that we begin by admitting our shortcomings, by admitting that we were not really prepared, but now we are ready to face any challenge in the state. And I would like to thank all the citizens of Nagaland who have given us suggestions, both positive and negative, both constructive and sometimes discouraging. But at the same time, we feel that unless we all come together, we will not be able to challenge this COVID-19. Thank you.
Okay, thank you, Mr. Mulumukikon, for, well, first of all, for clarifying many of the doubts, which, many people used to have the doubts. Thanks for clarifying. And secondly, I also would like to, as a president of the Naga Scholars Association, I also would like to just, give a little comment on what you have commented. That is regarding about the delay in, having this discussion, on COVID-19. Actually, what happened is that if we see the history of COVID-19 in Nagaland, it started only on the 24th of May. And after that, we started, of course, being away from home. We also started hearing about the issues.
Jamo,
So,
let me
yeah.
rephrase that statement because see,
Anyway,
COVID-19
yeah.
started in Nagaland on May 24. That's a wrong way of putting it. We cannot stop anyone from wanting to come home. Everybody wants to be at home in this time, especially of the pandemic, and we welcomed everyone home with the very clear knowledge that some of them might have contracted and will be bringing the positive. Therefore, we were prepared, and therefore, I would like to say that the stigma that we attach to them when we say that, I mean, is also another challenge that government is facing, and in this also we need to fight together.
Yeah, anyway, so what I would like to justify is that when we started seeing the issue, NSA thought that it's time for the NSA, the Naga scholars, to come together and do something for the state. So this is the reason why, it came little bit, you may say little late, but I think that's in real life.
No, but it's all right. I was just saying, yeah.
Anyway, maybe before we take few questions, I would like you to clarify maybe one question that is, regarding about you mentioned about testing facilities, testing capacities for not to allow community spread. So I want to ask you, what is the testing capacity and also the measures taken to contain a community spread? Yeah,
So,
would
I
you like
mean,
to briefly,
I think let me briefly answer that. You must have known by now that initially there were three zones: green, orange, and red. But after every zone became red, there is no such categorization. Now we have a containment zone and a non-containment zone. So our testing capacity till day before yesterday was 171 tests per day, and now this is within Nagaland. But added to the support we were receiving from Jorhat and Dibrugarh and Imphal, we were doing very little test. In 1 week's time, we are going to increase that testing capacity by 820. Number one. So all the positive cases which have been tested today, 10 of them after retesting, after having tested positive, after getting retested, 8 of them turned negative. So it's a positive step. We have been able to contain all the positive cases. They are all in the COVID hospitals, especially in Kohima, Dimapur, and now in Tuinsang. So with the machines, we've been able to ensure that I mean, testing is done properly. I mean, the repeat case and contact tracing. For instance, there was a error of judgment in Dimapur Civil Hospital. We have one, I can't name them, but there was a problem of identity, which was an error of judgment committed by one or two frontline workers, where one positive case was sent to parent without the result being out. So it was a violation of the SOP. So immediately, instead of waiting for who to blame and who to take action upon, we focus on containing that case. For instance, as soon as they reached Jaluki, the lady was put in the COVID hospital, and the other negative cases who were traveling along with her were put in isolation ward, declared containment zones, and till such time as the required institutional quarantine period is over and they are tested. Right now, the viral load is less according to the doctors there. Once the viral load reaches a maximum period, they will be tested in 2-3 days time for to see whether they have contracted the virus. So, I mean, these are some of the measures we have put in place, and we have done that because of the time that we have got during the lock time to prepare for this. Before that, I admit that we were not prepared.
Okay, thank you very much again for enlightening us on that aspect. Well, what we will do is that since we are running behind the time, we will straight away go to the second focus, that is regarding, reasoning together, to address the issues, finding ways and direction for combating COVID-19. So in this regard, I would like to request all the panelists to, to share, some directions as how, the challenges which are existing in the state could be addressed. So to start with, I would like to go with Dr. Sedivi.
Okay, thank you. I think this is a reasonably healthy discussion, and I would like to approach it by doing a SWOT analysis of our health systems. I normally do not criticize. I don't criticize unless I can give a very good suggestion, which I have tried it myself. I will not give a suggestion which is theoretical and which I have not tried it myself. I will only give a suggestion which I have found to work, found that it works. So when we do a SWOT analysis, we look at our strengths, our weaknesses, the opportunities, and the threats. So the strengths in Nagaland, which I feel are, one is we have a strong community, a very cohesive community. We are a small state, and therefore a small population is predominantly rural based, but a large number now in the cities or towns. And we also have English language and literacy, which is reasonably better than some of the other states. The churches and NGOs are fairly strong and are putting their best. Traditionally, we are an agriculture-based state, and we're not too much into manufacturing. So our economy may be a little more resilient. I may be wrong in this. And currently, we seem to have a committed government which is trying their best. I'm not sure what's there in the past, but as of now, they seem to be doing their best. So on these strengths, I think we should capitalize on these by doing a very good resource mapping. In any disaster management situation, you will always have initial chaos, and there will be maldistribution of resources. Some place you will have very strong resources, another place which you will have none, and in some place there will be wastage. So we need to do a very good resource mapping, strengthen the existing systems which are there, and also strengthen the alternative systems using community capital and resources. We also need to develop very good community health education for COVID and beyond. The COVID lessons will have very far-reaching impact in the future. So currently, I've seen from the Department of Health, they seem to have some material on training and education. And in our hospital also, we've got a whole team working only on communications and training and education so that we can use this and strengthen the hands of the government to disseminate it so that this aspect of panic and hysteria can come down. So we need to capitalize on all these strengths and cooperate with the government as much as possible. I just do not believe in blaming people. I feel it's absolutely useless to blame. We need to work on what we can do, not to blame. Secondly, what are our weaknesses? And our weaknesses are fairly apparent. Everybody knows about it. We have very poor infrastructure due to underdevelopment over the years. We have communities who do not have adequate, reliable information, and therefore there's panic. We have inadequate trained manpower because we don't have institutions of that nature. We have very difficult terrain and bad roads for transport over long distances. And we do not have enough coordination between the private and public sector. There was a lot of this, a lot of social media stuff which was going, which was quite unpleasant. And so I tried my best to try to bring this together so that, we can sort out a lot of issues of misinterpretation and things like that. So on these weaknesses, I think we need to really work on them. What are the things we can do? We can build infrastructure. The testing facilities which we are working on, the BSLs, the TrueNats, we need to have more training facilities. Some of these suggestions would be immediate, some will be long-term. Because COVID is not going to end in the next 1 or 2 months. It's going to be a long time. And therefore, we need also to think long-term. So we need to have teaching institutions and research centers which are strengthened. We also need to develop a good national lab network, and we also need to have dedicated isolation hospitals. The problem right now is the district hospitals have gone off the map for normal non-COVID people, and therefore that is going to be a major problem, because that is going to, a lot of poor people will not have access to health facilities, and all the non-COVID situations are going to suffer. We have just read, we know that the statistics is about 6,600 deaths in the country. But how many non-COVID deaths are taking place? I would be more concerned about that. If COVID deaths are important, but non-COVID deaths are equally important. We need to have a proper manpower development plan, both immediate and long-term, at different levels, technical or disaster management. We also need to identify all the design gaps, systems gaps, analysis, and correct these gaps. And there needs to be a lot of combined integrated planning and implementation between the government and private sector, the government and institutions, the government and church, NGOs, civil society, and press. Then the other thing is, on these weaknesses, when I mentioned about not having reliable information, we need to really improve communications. So communication channels will come in various ways. Circulars and orders are not the best means of communications. It is necessary, but we also need to work on education, workshops, information, and training. In Maharashtra has already asked for 800 doctors to be trained by the COVID course, which TMC Velo and Tata Trust has developed. So we will need a lot of doctors and nurses to be trained. Politicians and bureaucrats need reliable information from epidemiologists and clinicians, and these channels will need to be created so that they get reliable information on which they can act. The quarantine centers and inmates, they need information, education, and support. And the cleaners and centers in the quarantine centers also need a training and education. The churches and NGOs need information, training, on-site supervised visits to reduce the fear, stigma, discrimination, fear, and panic. And this will also, they then can also reach out to many others. So for this, we'll need a lot of help from developers, people to vet this information, multimedia groups like Dreams Unlimited, and also funds allocated for this. I think in the components of education, they will need to know not just what to do and what not to do, but how it is spread and how it is not spread, and what to expect, because people are, like we said, they have a fear of the unknown, and recovered COVID patients may be useful for this. In South Africa and many other places, the HIV patients are people who are used to help others, peer like education or help and support. And we need to protect the vulnerable ones, the elderly and less than 10 years of comorbidities. Now, we also need to look at the opportunities. What are the opportunities which are there? We need to identify the emerging challenges and opportunities. There's a lot of trained manpower which are coming back to our state. And if we can profile many of them, we can use them to develop our health systems. Now, before this initial COVID thing started, we didn't have any BSL lab, and we didn't have too much of RT-PCR work going on, molecular techniques. Now, when all these people came back, now I have 2 applicants from very highly qualified Naga people who want to apply. Now that is something which would have not happened if this COVID didn't happen. So there are a lot of skilled or semi-skilled people returning. And we also need to work on the COVID care centers. COVID care centers are a very important concept. You can't just, these quarantine centers, I think in the next 2 to 3 months, we will have a drastic reduction of them. We may not need so many, but the COVID care centers where you have asymptomatic or mildly symptomatic people, they will we will have quite a lot of them. So therefore, we need to improve the COVID care centers, have more of these, and really work on this to improve the quality of life. And that's something which we're all working towards. Finally, the threats. Of course, there is always a possibility and a fear of community spread. I do not think that we will be able to stop it completely because we still don't know enough. The district hospitals are not available to other conditions and illnesses. So non-COVID conditions will suffer and deaths may be more than COVID deaths, especially amongst the poor. And therefore, I think we need to quickly bring these hospitals back into the mainstream so that non-COVID patients and the poor will not suffer. we need to build new dedicated COVID hospitals if the funds are available, so that the district hospital, the Naga Hospital, Kohima, district hospital, Dimapur, come back to its normal functioning. And I think, our economy in Nagaland is quite fragile and it can crash further, and that can impact all the social determinants of health. And therefore, we need to look aggressively for ways to strengthen the local economy by even talking with, businessmen and, people, the agricultural growers, develop partnerships and things like that. Bring all these people also to see how we can strengthen our economy. Yeah, that's what, those are some of the suggestions which I can give. I think for those people who keep looking at social media and all, instead of looking at those for reliable information, I would suggest that if you want to look at Nagaland specific information, look at the Department of Health and Family Welfare website. If you want to know what's happening in India and some guidelines, look at the Ministry of Health and Family Welfare. If you want to know some technical things, look at ICMR website. And if you want to know global perspective, look at the CDC or the WHO website. Those will give you much more reliable information than social media stuff. Thank you.
Well, thank you very much, Dr. Sedevi, for giving such a rich, I should say profound suggestion on the issues of and the challenges which we are facing. You have very clearly pointed out also about the strength that our society, that the Naga society is having, talking about the strength, the strong community, languages, churches, NGOs, and so forth. But I really like, two suggestions that you have just pointed out. That is like a two mapping of our strength and capitalize them. That is number one. And secondly, develop community health education, and also, of course, building infrastructure and training facilities, COVID, and also other issues. Thank you very much for giving a very, I should say, a workable direction on the challenges that the state is presently going through. Well, I would like to go to Mrs. Mona Lisa Chang. When hello, hello. Uh, well, I think there are little disturbance. Some we need to switch off our, the audio.
It's already.
If you are not listening. Well, I would like to go to Mrs. Mona Lisa Chankicha. I hope she's around.
Yes, she's there, sir.
You have pointed out, in fact, many important points regarding about, the need for social awakening and strengthening social education, rebuilding our economic system, and also strengthening leadership, strengthening civil and social rights. I think these are, of course, in the first round itself, you have given a few directions, but maybe if you can focus on few things and if you can throw some light as how we can overcome the challenges which we are facing at the moment. So you may please take your time.
Right. Right. Thank you. See, first thing first, I am not Mrs. Mona Lisa Chankija because I use my maiden name. If you have to call me Mrs., then I am Longkumar, Mrs. Longkumar. So it's better you just stick to Mona Lisa Chankija, number one. Number two, you see, before I come to other things, what Monromo had so eloquently said, which you described as clarified, for me, that was not a clarification. Sorry, can you hear me?
Yes, yes.
Yeah, so for me, that was not a clarification. That was the side he was speaking about, the government side of the story, what they have done. So let's be a bit clear about, words, number one. Now, the other thing I'd like to say, Dr. Sedevi has done a great job. He's really worked hard to come with all these. But I think we have to blame people when blame needs to be given to them. why do we in society and state have certain do's and don'ts? Why do we have responsibilities? Why do we have, democratic countries like ours? Why do we have a constitution, a written constitution that says do this and don't do? Okay, when you have clearly written down do's and don'ts, and here I'm not going to even bring in George Floyd in the US. We'll leave that for some other day. So when we have very clear do's and don'ts in the constitution, very clear responsibilities of elected people, selected people, whatever, in within the government structure and systems, I think this very political term blame game we should get rid of it. If I am at fault, blame me. Have we not the guts to say yes, I am wrong? And how do we improve if we don't blame? See, we have this very traditional, cultural, traditional, and a very religious perspective of forgive and forget. That is fine at that level. But when we are talking about a democratic country, a republic, which is, you know, which is well defined in the constitution of the country. How can we say let's not play the game, blame game? So I think we have to be very clear about what our country is and what we expect of it and what we need to give to our country. Okay, which is why I said earlier that I am very concerned about social and civil rights and liberties and freedoms. Okay, because we cannot say that, of course, if a bureaucrat, a doctor, a lawyer, a politician, a minister is to be blamed, let us blame him and let things follow from then on. That is what democracy is all about. That is what justice is all about. One, two. Now, three. How do we build a chair if we don't have the image of a chair in our mind? So we can come up and say that, listen, I want it like this. I want the left arm to be like that, the right arm, the height, the breadth, whatever, the color, whatever. But we must have a very clear concept of the chair, okay, with the exact measurements, the material that we are going to use, etc., to build a chair. Now, we can say that, oh, we need to do this, we need to do that, we need to do this in the education sector, this, in the medical sector, in the media, in the bureaucracy, in the state assembly. We can say that. But we must have a very clear concept, a very clear uh, idea, a very clear picture of what we want our state assembly to be, what our media to be, what our hospitals, our doctors to be. So, when we are talking about, the first part, we were talking about the challenges. Now we are talking about how to move, kind of a way forward. So, first of all, and I kept on saying, I said earlier about ideas and ideating. So, we have to start all over again. Okay. And we have to keep at the center of our mind, at the center of our eyes, we have to keep the image of what we want our state to be, our people to be, our health, education, etc., to be. Now, Monlomo, you have given very good, news just a few minutes back that out of the 10, 8 have tested negative. And that is very good news for a small state like ours, okay? Now, the thing is, how many times would they be tested? Probably this is something a doctor should be able to answer. But then since you are there, and so normally how many times? I remember the first case that we had in Nagaland. You remember that fellow from Dimapur who was sent to Guwahati for treatment. Uh, so if I remember correctly, and I'm pretty sure I remember correctly, he tested positive, then negative, then positive, then negative. That means 4 times. So 2 positives and 2 negatives. After which, of course, the GMCH released him. So the norm, what is the norm? How many times are we going to test these people? That is one of the things that Monlomo can say in a few minutes' time. Communication, and Monlomo is very, very right. Monlomo is very right. And I wrote about it the other day. The communication from the government has been excellent. We didn't have. In fact, there was a surfeit of communication. What happened is not because there was no communication. Every 2 minutes, the government, in the form of the chief secretary, additional chief secretary, the DCs, whoever, were keeping a constant smooth flow of communication. The problem arose when that communication was not translated into action, and that's where all the gorbor started. So now, also about the returnees. I mean, this aspect comes under that what I talk about employment, the economics. And I'm sure that in a matter of time, the government, I understand right now they are busy with the medical side of it. And so in course of time, the government is going to come up with some kind of think tank, people, knowledgeable people within the state and outside the state to, re revamp our economy. Let me say, build our economy. But my only point here is that do we not have enough people in the government who, could be entrusted to look after this economic side of it, side by side, when the medical side is being taken care? I think we have enough people in the government, the elected people as well as the.
So can I just interject, Mona Lisa?
I
Just
think let
interject.
her finish it, please. I think
No,
let her
no.
finish.
Before she goes ahead with
Then
this
you can
topic,
come in. You can come in after that.
I just want to inform her because the government has already instituted an expert committee on both the agri and allied sector and also the economic, post-COVID economic plan of the state, headed by the chief secretary. And I mean that's under him, yeah. So let us go on to the next.
Yeah.
No, the only thing I want to, the last thing, I have a lot of things to say. If you get me,
We are running short of time.
Yeah, I know. Only thing I want to say one thing. I mean, I quite don't agree with.
But Mona Lisa, we can also always call each other and discuss.
Yes. But then this thing I need to say. I don't. I'm not sure about the panic. Monlomo saying about people being the Nagas being most panic and all that, because it is quite contradictory to the fact that our district administration, civil and police administration, they're having problem keeping people inside the house. Means people are moving out. They are not panicked, and that is the fear that our people are not panicking enough. And don't mistake the real panic in our neighborhoods or the absence of panic in our neighborhoods, in our streets, and the panic that is being portrayed in social media. Okay, social media, hang it. But I'm talking about, I mean, the real life. People are walking, visiting, inviting each other for dinner, all that. So I'm wondering, where is that panic? Now, I want to say more, but then I know everybody has to have a chance. And I see a lot of questions also. Back to you, Duchamo.
Yes. Oh, thank you very much. Thank you very much. In fact, I think so many important points you have, brought up even in the first the round of presentation, and well, the second, of course, you have also given a very proper justification on that. Thank you very much for throwing your perspective and as how we can address the challenges which we are facing at the moment. Now we will go to Father Abraham Lotha. So I request him to kindly come forward and give some direction as how we can address the challenges which the state is facing at the moment.
Well, the first thing, as many have pointed out, as we say, our community is our strength, but it can also be our weakness.
Yeah.
What I observe nowadays is many communities, are they go extreme in terms of trying to tackle, especially the quarantine places after they're released and tested and released from the quarantine places in Dimapur and Kohima. Those people going to villages again have to stay for like 14 days, 28 days. I think there's a lot of extreme reaction. So if people can have proper education, I think it'll be good. The second thing is because Nagaland is a Christian state, many people also tend to use God's name, that this is a curse by God and God is punishing us. I think we have to be watchful and mindful of that kind of using God's name in vain. And the third thing is, all of us, I think, have to look out. Sometimes the fear of being stigmatized will prevent the sick person from telling others, and getting help. So if people notice that, I think we can help people who are sick to get proper treatment. And because this is also a panel organized by the Scholars Association, Naga Scholars, I think there are a lot of people watching this who may be wanting to do their PhD or other studies, research. I think the sociology or the culture of such pandemics, or how this kind of pandemics affect our societies and how our society is dealing with, is a good research topics for those who are in academics. Also to people in Nagaland, I think we have to. I was like, I feel bad for our students. They're missing class so much learning, and so maybe a good time also to think about how are we going to start up a society, how are we going to start up education, the schools, universities, colleges, and also, as Mona Lisa pointed out, and many others have, in terms of how do we restart our economy. I think it's good to deal with the present moment, but also to look to the future. And finally, it is everyone is responsible for our own health. It's important to do that, not only depend on government or other civil society to tell us how to be healthy. Everybody is responsible for our own health. Thank you very much.
Oh, yes, thank you very much, Father Abraham Lotha, for respecting the time and also pointing out a very clear, direction as how we can address the issues we are facing. And I think one very important point which you have mentioned is regarding like encouraging researchers to, think about, some research, on this particular challenge which the state is going through. Thank you very much. Now, I would like to go to Mr. Abhishek Singh. I request him to kindly come forward and maybe give some direction as how the state, Nagaland state can address the challenges, the issues which we are going through.
Thank you, Chamo,
And sorry for keeping you waiting for a little longer
no,
time.
it's all right. Thank you, Chamo. In fact, I would really like to congratulate you for taking this initiative.
Thank you.
It's been really an enlightening discussion, and I think an online way of discussion is much more focused and better compared to when we meet in person. So again, this is one of the learnings of the post-COVID or during COVID environment, that we have adapted very quickly in using online tools like Zoom conferences or Teams conferences, video conferencing, and ensuring that life continues. This shows that there is life during COVID, there is life after COVID. So we have braved the storm and we are preparing ourselves to prepare for what is coming. So this gives a lot of hope in what lies ahead. So I have already spoken about the COVID response, the importance of communications, busting fake news, and trying to create a positive environment about fighting the COVID and a coordinated approach. What I would like to address is the few issues which were raised. Of course, I am part of, like, I have been worked for government of Nagaland. I have been belong to Nagaland cadre, so I feel part and parcel of the state and the government per se. So, having said that, I would still like to mention that in many ways the response of government of Nagaland vis-a-vis many other states has been much better and has been appreciated at various forums across the in meetings where all states were included. It's quite okay for people to feel frustrated, and people in a democracy that's always happens. The more you do, the more people expect. So the people have a right to complain, people have a right to ask questions, but that's how a democracy functions. And media and citizens, NGOs, civil society, they will always question, and we should never kind of get upset that why are people asking questions, because if they give up on us, they maybe they will not. So as long as there is hope, there will be questions. So we should be happy whether it's in the central government level or across the country. We see the same kind of response from many people in government of India also. Like when we launched the Arogya Setu app, we are bombarded by people across, and when we engaged with them, we explained to them why we are doing what. Then people explained, and not only within India, we were like attacked by hackers from France and all, who made all kinds of complaints. So the way we function in the government is that this is normal. So we take it in their stride, and we try to take it as a feedback in trying to do better what we are doing. So that is what we need. And when we look at the steps that the government of Nagaland has taken, so the Molomo has already mentioned about that, but the kind of steps which state government took of extending financial assistance to students and people staying outside the state was one of the first. And after Nagaland, Himachal Pradesh, Manipur, other states also followed up. Then the state also took the stand of giving financial assistance of almost 10,000 rupees for people not to return to the state. And that was, of course, trying to achieve two objectives in trying to extend help to people who are stranded because of being jobless or because of losing their livelihoods wherever they are working, and number two, for ensuring that we prevent the coming of virus in the state. But again, that is something that we cannot avoid. It's a constitutional right of every citizen of the state, of the country, to travel to wherever he wants, more to the home state. So when people wanted to come, when the trains were restored, when the flights were restored, people would come in. So once they are coming, then the necessary steps with regard to quarantine arrangements are being taken. On the economic side, what this challenge poses is that we need to think of what do we do, what happens. Like right now, so many Naga youth who were employed in across the country, whether it's in Delhi or Noida or Mumbai or Pune or Bangalore or Hyderabad. When these people are coming back, what happens next? There will be a tomorrow. They will be going back, because otherwise, how will we absorb them in the limited jobs that exist? And if they start competing for the same jobs which exist in the state, then it will further affect those who are within the state looking for those jobs. So our economy in the state is dependent very much on the mainland India. So we'll have to think of ways and means of trying to get them back to the jobs that they had, trying to help them provide health security, health insurance, health security when they go back. And it's also an opportunity for the state to do a kind of a skill mapping. Like all the students or all the workers who have come back from the state, what are the skill sets that they are having, where they were working, how do we tie up with the industries? Because in mainland India also now slowly industries are coming back, but again, a lot of sectors will be stressed for the next 2 years, like the hospitality sector, the tourism sector, in which a lot of Nagas are employed. They will be stressed for the next 2 years. So many of them might not find jobs immediately. So what do we do to address that? And added to that, another complexity that the state will face is the reduction in the revenues. Because what is happening, and again here also Nagaland was again one of the pioneer states which moved in to increase the taxes on petroleum products, which was later on followed by almost every state. Because what do the state governments do? Because what is happening is that with the lockdown, government of India's GST revenues has gone down by almost 88% in the month of April, and the total reduction in revenues is estimated to be almost 500,000 crores. So when the government of India's tax base revenues come down, then obviously the Nagalands or every other state which gets share of taxes from center, like 42% of the center's tax revenues goes to the state, is devolved as per the finance commission formula. But when the size of the cake is getting smaller at the central government level, the amount of revenues that will come to the state will further get smaller. And especially a state like Nagaland, which is dependent to a great extent on the revenues which come from the center, it will add to huge fiscal problems. How do we survive? How our tax revenues are not going to go up? The GST share in GST is going to come down. So when that is happening, state will have to think of levying additional taxes. Almost every state has done that. Petroleum taxes increase, even though one feels that worldwide crude prices are coming down, but why petroleum prices is going up? But if you don't do that, how do you pay salaries? How do you build hospitals? How do you build roads? How do you build schools? How do you pay your teachers? There are some questions about Asha and Anganwadi workers being not being paid. So if the money will not be sourced, then these problems will be there. Delhi, in fact, the other day, last month, increased taxes on liquor by almost 70%. They increased petroleum prices also. Why did they do that? A state like Delhi, which has got much more revenues than a state like Nagaland. So to say that nobody is thinking about economy in Nagaland is incorrect. The very fact that the state government was one of the first movers to extend financial benefits to those who were in need, the 3,000 rupees or 4,000 rupees or the 10,000 rupees for people who were to come back, the decision for the state government to proactively increase the taxes on petroleum, even though it may appear unfair, but then it has to be in a taxes are never liked by anyone. But when you have to run a state, when you have to pay salaries, when you have to run hospitals and run schools, some hard pills are taken, and those who have money, they only will pay. So that is the logic behind doing that, and almost all states are doing that. Nagaland is limited. We have NLTP, so there is no provision of increasing excise revenues. So we will have to think of innovative ways. In what ways people who are resourceful, people who have money, people who have much more assets, can they contribute to the building of the state? Can they contribute to reclaiming the economy back? And one way will be to measure our strengths. But whatever I see, we may have expert committee, we may have that, but it's not going to be easy. It's a tough call for everyone. And at this stage, if we start indulging in name calling and we start accusing people, it is not going to solve any problems. Asking questions is fair, seeking answers is fair, but please, I would just urge upon everyone, every citizen of the state, to not question the intent. The intent will be there. Solutions are not easy to find, and finding solutions in such a pandemic, in such a crisis which the world is facing. In fact, in my lifetime, I have never seen such a crisis, and probably this is the worst crisis which the world is facing post Second World War. And the history will be known post COVID, pre-COVID, post COVID, just like we regard history as pre-World War and Second World War. And the Second World War led to formation of new nation states, colonialism coming to an end. So similarly, there will be realignment of forces. Already in India, like India is also facing a huge crisis with regard to rebuilding up. So we are trying to attract investment. We are trying to get companies who were moving out from China, because the Europe and the West, they have realized that too much of dependence on China is not going to help. So the China plus one strategy is being talked about world over. So in India, we are trying to, the economic policies, the Department of Industrial Policy and all, they are trying to ensure that what can we do to ensure that manufacturing and factories which are building electronics and other products comes to India from China. Incentives have been given. The other day we announced the production linked incentive scheme for electronics manufacturing, which is going to move telephone manufacturing, electronics manufacturing, mobile phones manufacturing to India. Apple has we are in very highly advanced, very advanced level talks with Apple to move the manufacturing of the Apple iPhones to India. So when all this is going on, MSME sector is in stress. So there are companies that are not able to pay salaries. So a lot of incentives have been given to the MSME sector. The champion sector scheme has been launched. So when all this is happening, what we need to do in Nagaland is try to see where are our opportunities. What is it that we can do to ensure that we become a partner in doing this? And this would require contribution from every citizen of the state, from whichever walk of life he is in, whether they are in civil society, whether they are in NGOs, whether they are in media, whether they're in business. Everybody will have to put their head together. And this is not the time of pointing fingers. This is the time of standing united. This is the time of contributing to the constructive thought process. And this would require a lot of trust building. The state, because of obvious reasons in the last few years, because of the conflict, because of so many issues, all of us are aware of that. We have led to a situation where there's a lot of trust deficit between the people and the citizens. How do we build those bridges? How do we ensure that we all contribute in a constructive manner? And how do we contribute in such a way that states emerges stronger from this? And there is an opportunity. If businesses come to India, there will be a opportunity to be made for Nagaland, but then we'll have to adapt, because there also we will be competing with every other state. What is it that Assam is offering to an investor which we can? How do we kind of are we able to tweak our land laws? What is it that prevents an investor to invest in Nagaland? We have a lot of food products, our turmeric, our ginger, our passion fruit, all of it. There are pineapples, but can we think of building a food processing unit? What will it require if a Dabur has to set up a plant here? Our many of with the focus on Ayurvedic and these herbal products and with organic products, there will be a shift with this all the healthcare focusing on herbal and organic products. So do we have an opportunity there? How do we attract the investors? How do we set up factories? How do we set up plants? And that we will employ our youth. How do we think of building the call center industry here? Many of our youth were in call centers all over. So if they can be employed here, how do we kind of harness tourism? Because tourism will be impacted for a long time. The international tourism will go down. People will think twice before going to Europe on holidays. People will not want to go to China. People would not want to go to Thailand, Malaysia, all these countries, because the international travel is not going to pick up in the next 2 years. So can we leverage on that? Can we build better in tourist facilities that will employ many of our young boys and girls who are trained in the hospitality sector? So all that will require a rethinking, but thinking that it's only the government's job will not solve the problem. We'll have to collectively join hands. We'll have to collectively strengthen the government, build in faith, build in trust, and then we will be able to overcome. So this is what I wanted to especially add over and above what I've already said about COVID and our response. There is a great opportunity here, and it's if we join hands, if we think together, if we work together, we'll not miss this opportunity. Let's be positive and try to strengthen those who are trying to bring out a change in the state.
Yeah. Well, thank you very much, Mr. Abhishek Singh, for giving such a rich perspective as how we can deal the challenges ahead of us. Well, you have mentioned very many important points, but I want to just pick up just four. One is you are, like, I really like the way you are encouraging the Naga scholars, especially, and also the listeners, to capitalize web technology, and using it for having, meaningful discussion and discourses on issue concerning maybe our state, or it could be concerning any other things that are important, in societal building. So thank you very much for that point, and also would like to thank you for also give your perspective, on plan for creating, health security for especially for those people who have just returned from home, with no jobs. So I think that is also something which the state government also should be ready in addressing that issue. And you have also very specifically mentioning about addressing the issues of the revenue of the state, which are very much going down. And I also like one of the points which you have mentioned, one of the directions rather, that is identifying capable people, and rather mapping capable people who can contribute in this kind of situation, bring them in, encourage them and bring them in rebuilding, the Naga economic, the Naga society rather. Thank you very much for giving such a rich perspective. We are now going to take a few questions, and we have, I can see Dr. Walunder, who would like to raise a question. So now the time is given to Dr. Walunder, who is one of the senior member of the Naga Scholars Association. Please come in, Dr. Walu.
So, thank you, Zuchamo, and thank you all the panelists for the very varied perspectives. I'd like to ask a lot of questions, but then I'll ask only one question.
Sure, yeah.
I'd like to ask this question to our legislator, Shri Mandima Kekon. Yes, the government is like the father figure, so it is expected to sound calm and confident in times of trouble, whichever government it may be. So I'm quite encouraged to see a lot of confidence in you, in your talk and the way things have been planned. Of course, the results of that confidence and what all our government has planned, the result of it will come out only after a few months. That is one. Here is my question. Uh, Within the global trajectory of COVID-19 pandemic, Nagaland is in stage 1 only, and Nagaland is yet to go through the different stages of the pandemic. Until now, civil society had been tirelessly shouldering a lot of responsibility with the government, whether it be in donating money, in volunteering, in maintaining social distancing, in controlling lockdown here and there, and in providing and maintaining the quarantine centers. So the civil society had been shouldering a lot of responsibility, but this is stage 1 only. As we move on to stage 2, 3, and 4, the civil society will not be able to go beyond the quarantine centers. So the civil society cannot be expected to go beyond the present involvement or contribution. So then, how is the Nagaland government prepared to deal with the other issues that will come up as we move on to stage 2, 3, and 4? Like, for example, hospitals will become overwhelmed. The civil society cannot come in there. The health facilities will run out. The civil society will not be able to shoulder responsibilities there. Health workers, the doctors and the nurses will fall short of being infected or quarantined. The civil society will not be able to come in there. So there's a limit to the participation and involvement of civil societies. How is the Nagaland government prepared to deal with the upcoming situations from here on?
Hello, Dr. Walunia. Very nice to hear your voice after a long time. Let me begin by situating your question to the Nagaland context. Let me also say that it is presumptuous of anyone to think that the government is doing nothing. Why? Because the civil society has been supporting the government, but the government has been shouldering 99% of the burden. Let me be very clear. All our workforce, from the police personnel, nurses, frontline workers, and the administrative officers have been on the spot. Civil society helps us by various means. But when it comes to managing the quarantine facility, quarantine centers, it is the government agencies and the government personnel. So let us not be presumptuous about that. Number one. Number two, that question is actually a little too late in the day. Let us look to the future. Our challenge, number one, is you see, when we look at the quarantine centers, we have 13,000 approximately. It's a little more than that, but approximately 13,000 beds and around 284 quarantine centers. Now, if you look at the first batch of returnees, most of them are recovered and they're going back. So in terms of the spread of responsibilities in every district, we are now looking at certain positive cases, 107, out of which 8 has recovered or tested negative today. Now, if you look at the entire scenario, we have been doing a mapping. So the number crunching is done by our war room. So we have all the data with us, the incoming and the outgoing, and also the balancing and the distribution of the returnees in all the districts. So number one, negative cases, people who don't have the virus, and the asymptomatic cases are being sent to the respective districts. And positive cases are being right now treated in only 3 hospitals, Kohima, Dimapur, and Tuinsang. And we have testing center in we will have testing center in all the districts in the next 5 days, so that we have put the necessary infrastructure in place to address this COVID virus. So if you look at it, unless we have the nearly 2 million Nagaland population affected with COVID-19, we will not have a stress over our human resource and the health infrastructure. So if you look at it, the positives, God forbid, should not go beyond what we have, and we would expect the healthy asymptomatic cases to recover soon, and we would not have a stress on our health system. Yesterday, I was having a discussion with Dr. Setivi. For all the asymptomatic cases, in Dimapur alone, our collaboration with referral hospital, they are willing to treat around or take care of around 200 asymptomatic cases in a COVID care hospital or a COVID care center as per the ministry guidelines. So that thing is in the pipeline, because we have receiving, we've been receiving returnees for quite some time now. Our preparation is based on the number of people coming and the containing and the containment we have ensure that we would not have community spread. So unless we have community spread, we will not be having the kind of stress that you are talking about. So who knows, in the days to come, if like Dr. Abhishek has, no, Abhishek Singh has said, if a vaccine is approved, then I think in the next 2 months, we will have less pressure on our health sector.
Okay, thank you very much, Waluner, for raising a very important point. And we also would like to thank our MLA, our advisor and spokesperson of the state, for giving a very in a way like satisfactory answer to the question. Well, we thought of taking some more questions, but the thing is that now it's almost 2 hours 10 minutes, so we have to wrap up. So I think what I will do now is that whatever questions you have, you can just write it down on the chat box. And what we will do is that after the this channel, this panel discussion is over, we will collect them and we will try our level best to give it out to the panelists. So you please mention when you write a question, it has to be mentioned to whom you are asking the question. Let me give a very brief concluding remark to our panel discussion today. From this discussion, of course, we do realize, we also found that there are problems. There are problems in the state. And of course, the state government has been also trying its level best. But at the same time, there is also a need that the state government should strengthen, strengthen in order to address the challenges which are going on at the moment. And some of the way forward, and this is very, very important because this is the main objective of our today's discussion. First, we discuss about the issues and challenges, but the most important is the way forward. The way forward is very important. So I will try whatever I have captured, I'll try to briefly present it. Well, the first thing is that, there is a need for identifying our strength, that is mapping the strength of our Naga society and capitalizing them, for rebuilding or building our Naga society. Secondly, there is a need for, a need to develop community and health education in the state, and also building infrastructure and training facilities for testing, and not only necessarily COVID, but other issues as well. And there is also a need to re-looking at our economic system and rebuilding the system to face the present challenges and also the future challenges which are ahead of us. And there is also a need for strengthening civil and social rights, of course, which one of our panelists has strongly pointed out on this. And there is also a need for managing fear culture, which has been created by COVID. And even this one of our panelists have very clearly mentioned on this. And I think whatever issues the state is going through at the moment is also it is more to do with the the fear which has been created, which may not be very necessary, but which has been already created in the state. So this is also something which we need to address, how to address this fear culture that has been created by COVID-19. And the issue also, we are, there is also an issue, which we are facing today, regarding like there is also a need for researchers. We have many Naga research scholars who should look at this the challenges which we are going through, and they can also take up as a research topic, not necessarily for a PhD, but also for writing research articles, and which can be, the recommendation can be given to the state government. And another very important, which one of our panelists has mentioned, is making best use of web technology for, discussing, issues, meaningful discussions like these things for, in a way, like for, building our society. And of course, there is also a need to plan very specifically for those stranded, returning who have just returned from Nagaland. It is mentioned as of now, 8,000 people have already returned to Nagaland, and many more are still yet to come. So the state government also should plan, as how to address this issue. And of course, finally, like one of our panelists have very strongly pointed out, how to identify capable people, who can be encouraged, to come in rebuilding the Naga society. Well, with this, would like to conclude our panel discussion, but I would like to, on behalf of the Naga Scholars Association, would like to give, thanks to all the panelists for taking out your time and giving a huge contribution for the success of today's panel discussion on COVID-19 in Nagaland. And a very special thanks to Mr. Prahlad Jadhav and his friend for sacrificing their time and giving us such an effective, technical support all the way from Mumbai. And special thanks to also to our reporter, Mr. Loong Nathan, one of our executive secretary of NSA, for doing the reporting for today's discussion, which will be published in different newspapers. So that is also one which is very important. And finally, on behalf of the Naga Scholars Association, we thank all the participants for, for coming in and witnessing, and also, giving a very meaningful participation in today's panel discussion. With this, we come to the end of our today's panel discussion. Thank you so much to each and everyone.
Yeah, thank you.
Thank you.
Thank you.
Thanks a lot. Thanks a lot.
Thank you, sir. Thank you.
And
Thank you.
Please
Thank
take
you.
care, everyone. Yeah.
Yes.
Thank you, everyone.
Thank you.
Prahlad,
Yes, can I end the meeting, sir?
thank you so
Bye.
much. Yeah, we can close it. Okay.
Thank you, sir. Thank you.
Yeah, thank you so much. Yeah.